Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about fistulogram. Fistulogram is a radiology procedure to evaluate the size and shape of the fistula tract before surgery or medication. The fistulogram is performed by the radiotechnologist in the presence of the radiologist. Fistula. The fistula is abnormal connection between two natural hollow structures or two body cavities or one body cavity and skin surface. The fistula may be congenital or develops after surgery or injury of an organ. Types of fistula: anal canal or bowel lobes and skin fistula, vagina and rectum fistula, intestine and bladder fistula, a fistula between the two or multiple loops of intestine. Indication: opening near sutures, wound or any part like anus or vagina, pus, fluid, waste leak from the opening, throbbing pain, swelling near the affected area. Contraindications: hypersensitivity to iodine, suspected pregnancy. Patient preparation: no special preparation is required for the examination. Women should inform about any possibility of pregnancy. Pregnant women should not have a radiologic examination because of the risk of radiation exposure to the unborn baby. The patient is instructed to remove all the metallic objects and metallic jewelry from the region of interest. Equipment: fluoroscopy unit with spot film device, local anesthesia, catheter or cannula sleeve, contrast media, which is water soluble ionic contrast media for fistulography examination. The water soluble ionic contrast media is better than barium sulfate to evaluate intestinal fistula. Next is normal saline, gauze, sterile towel, antiseptic solution. How the procedure is performed? The examination is performed in the radiology department. A radiotechnologist will perform under the guidance of a radiologist. On the day of the examination, the technologist should describe the whole procedure to the patient and obtain written consent from the patient for permission of procedure. The patient is asked to remove clothing and wear a hospital gown. The patient is placed in the supine position with an empty bladder on the fluoroscopic table. An intravenous line is inserted into the patient arm. If necessary, sedative medicine is given through the line to make the patient relax. The fistula is cleaned with an antiseptic solution and the local anesthesia is applied near the fistula for numbing the area. Local anesthesia may be mostly of lignocaine or xylocaine gel, or they will give it as an IV medicine, they will give it as an injection. Okay. Next, then the radiologist selects a catheter or cannula sleeve according to the size of the fistula. Then the radiologist advances a catheter or cannula sleeve into the fistula tract. Afterward, the radiologist slowly injects 5 ml of diluted ionic contrast media mixed with normal saline into the fistula tract under fluoroscopic guidance. After filling the tract, several X-rays or spot films are taken in anterior posterior view, that is AP view, lateral view and in oblique positions to access the fistula tract. After completion of the procedure, the catheter is removed and the wound must be cleaned and covered with the dressing. This is how the X-ray of a fistula and a CT scan and MRI scan of a fistula looks like. Aftercare: the patient is allowed to leave the examination room after completion of the examination. And here the complication, most of the complication will be swelling near the swelling near the wounded area, or else they'll feel like some irritation will be there. This must be the complication. Other than else, no complications will be there. So, thank you.